Welcome to the Healers Café, the number one show for medical practitioners and holistic healers to have heart to heart conversations about their day to day lives while sharing their expertise for improving your health and wellness. So, welcome to the Healers Cafe. And today I have with me Nelly Naguib, and she's an integrative physician in Egypt. She's a Bowen therapist, a holistic nutritionist, and a former naturopathic doctor in Ontario, Canada. And I've got to say, I've had the pleasure to work with this woman and be in her presence and even create things together. So I am so thrilled that you've decided to be on this show together and share, your everything, your life. Everything has been such a extraordinary journey. So welcome.
Merci, Manon, very much. The pleasure is mine, actually. I was looking forward to see you again.
Well, I guess the technology makes it possible.
Yes, indeed.
Oh, so why don't we start? Because normally my question is, what got you into health in the first place? And I think with you, that's a good question because there's been many steps on that route. So go ahead.
Okay, so my story started when I was a child. I grew up in a home with parent physicians. My mom was anesthesiologist and my father was a dermatologist. So I grew up in an environment that my both parents are helping people around them, like neighbors at church, whatever. So it just built up this kind of feeling inside me that I also want to help people when I grow up in the same way that my parent did. So I was studying hard. I was the first in my class in grade 12. I went to medical school with a very high score, and I finished my 6 years of education plus 1 year internship. But at the end, to my shock and surprise, that conventional medicine did not give me all what I want. I
Mm,
realized at the end of the day, the only I have a prescription pad and I have to write medications on it. So during my internship, I encountered non-wealthy people that they cannot even buy the medication. And I
mm,
didn't have the knowledge to let them know how to live um, a good lifestyle, like how to eat, how to drink, how to sleep, how to deal with their children, all that. So, and I was thinking, what should I do more to
mm,
make my dream full? How can I achieve my full potential? So when I came to Canada, I passed my Canadian exams, and unfortunately, I couldn't go into the system because of the all Canadian know that physicians, international medical graduates, so hard to get in the system because of their maybe the country they are coming from or any kind of situation. So I decided to um, look around and see how I can become a physician still. So I got to know the Canadian College of Naturopathic Medicine, and I enrolled. I was accepted, and I did homeopathy and naturopathy at the same time. I graduated in 2015, and I believe Manon, along the way I met you.
mm. That's right. I may have been teaching, I think, at the Boucher College. Is that possible? Or no, it wasn't in that context. I can't
No,
remember.
it was Bowen College, and I
Oh,
knew
Bowen
you.
College, yes.
Yeah,
That's right.
at Bowen College, and I knew you through the Canadian College of Homeopathic Medicine
That's right.
link.
Mhm.
Yes. So I said, okay, I wanted to learn Bowen and don't know what to do that. So I got your introductory course online and I felt because before I was introduced to another Bowen teacher, but it didn't resonate well with me. I thought, oh, that's so difficult. I don't know if I can put a hand on this. And then when I did your introductory course, it was online, I remember.
Yeah,
Was, oh my
reboot.
God, that it was so, yes, the reboot course, yes. And I said, oh my God, that's so nice. I did it and I finished it. And then I went to the part one and part two in the condensed way with one of your TAs. And then the final one was with you when you came to Toronto. And I wasn't ready to take my exam and said, "Oh, you take your exam today."
It's always the most qualified people, the ones with the most degrees that feel they're not qualified to take a degree, right? But it's like, or to take an exam, right? And the thing is, what I teach is a hands-on technique, as you know, and if you're connected to your heart and the desire to help, your hands will remember what needs to happen. So I was very
Yes, I
startled.
wasn't prepared for my exam, but my hand remembered all the moves that he taught me. So I passed my practical, and then before I become a naturopathic doctor, I start to be a Bowen therapist, registered Bowen therapist. And during my internship as a naturopath, people, my superior, my teachers, told me, "Oh, like same like they said homeopathy doesn't work, they said Bowen doesn't work." So I will tell these people and challenge them. Just give me 15 minutes of your time and I will show you that Bowen actually work. And whoever give you this wrong notion is like wrong. And
Mm,
then I remember some of my colleagues will have headaches and I do like the 15 minutes head protocol on them and they get, "Oh my God, I not need Advil now. It's gone." And this gave me more confidence. I worked with more people, and to become a registered Bowen therapist, I went through 10 cases of my friend and family. I
right.
accomplished a 5 to 6 session each, I believe, and all of them was like perfectly well. I worked with difficult cases, chronic back pains, neck pains, MS patients, and so on. And afterward, I finished my ND. I became a naturopath. I became a registered ND, and I did also the diploma for holistic nutrition with Edison Institute of Nutrition. And I have been working until COVID hit. And then I realized that, oh my God, I cannot keep my living like this. I'm stuck at home. I cannot do bone therapy. I cannot do anything. So this when the idea to my head came, okay, let's go back to where I started as a medical doctor. I passed my test. So what left for me? Okay, they need recent experience. They need postgrad training. They need the postgrad education. No problem. So I moved to Egypt in 2021. I joined the family medicine high diploma. Uh, I passed it, finished it. I am a family doctor now in Egypt.
Amazing.
And at the same time, I was during my stay there, I was doing Bowen therapy on too many people. People who were like struggling with pain meds, on muscle relaxant, taking Lyrica high dose. I have done a lot with Bowen therapy that you could even imagine. People
Wow.
tell me, "Where did you get this information from?" I said, "Oh, this is my mentor, Manon, my friend, taught me this kind of technique. And I'm so fascinated taking people off their pain meds gradually. So
Yeah.
it will not be harsh on their body. And replacing it with more holistic way of how to deal with pain by hydrotherapy, by exercising, giving a session every week. And I found that my full potential is to become an integrative physician, like
Mm,
apply conventional medicine, holistic medicine at the same time, start naturally. If I need for medication, I will put the medication in. When the time is good, I can take off the medication again and make the people live their life, quality life. And
yeah.
I feel this is actually my mission is to help people live to their maximum potential, not just to be kept on one, two, three, up to 10 meds for the rest of their life.
Yeah, yeah. Yeah, that's not at all a lifestyle that makes any sense. But I'm very curious, when you had two parents that were medical doctors in the field and they were helping people, and you were inspired by this desire to help. Do you find that what they knew and what they included in their scope of practice is actually different than when you went to medical school?
Where because I am originally Egyptian, so that Egyptian culture, the way we practice medicine there, I believe, different than how Canadian and US people, even Western people practice. Because going to the root of Egyptian culture, we use herbs.
Right.
It's not, there is not medication for everything. So my mom was well aware about how cinnamon can help during menstruation, how we can take lemon water, how we can do honey with lemon. Like I grew up with this kind of culture. So
Right.
being a holistic practitioner wasn't difficult for me. So my mom and dad was helping people not just by medications. They can
Yeah.
give them recipe like chicken soup or
Right.
things like that. They
Yeah.
didn't know much. Not
Yeah.
like I went through school and I learned, but
Yeah.
it's part of our culture. Then that's why I resonated more with holistic practice because
Mm.
it's part of my culture.
Mm. But and I think, it's interesting because there's the cultural component, but there's also like I'm looking at my family, and my uncle was he's passed now, but he's a thoracic surgeon. And, he said, I asked him before he passed, what is the most important thing you've learned in all of your practice and in everything that you've done in medicine, And he says to love your patient, and I'm thinking, wow, okay, you don't hear that in the way it is today, Now we've gone into, I mean, most of the doctors are basically doing prescriptions, like you said. They're not really looking at the person they're treating. There's not this heart-centered, patient-centered approach. That's extremely rare, so I think that has also changed. And I think been a backlash in this last few years, now that people are questioning, the authorities and the medical authorities, and you know, even those who say, "Oh, I was just following orders," and it's like, wait a minute here. Did we not have an oath? Did we not pledge to at least put the patient center first? And I think people are waking up to realize that it, most doctors are cogs in the wheel of a big pharmaceutical, ultimately military complex. I mean, they're not free agents really looking after people anymore. And
Well,
people want to change, so
well,
anyway, that's my
well. The way I see it is, medicine is not a profession.
right,
Medicine is a mission. So if the doctor doesn't have this in his heart, he will use the profession just to gain money and that's it. But
right.
if it's an actual mission that this is his calling, this is not a job I am doing to earn money. Yes, and money is important, but on the other side, if this is my mission to help people get better, I want them to get better as fast as possible. I
Mhm.
don't want them to stay with me for 3, 4 months until they see results. That's why when I was practicing Bowen, sometimes like this patient I'm treating now for over a year, I was called by one of the bishops in Egypt, and he sent me to this friend of his. He told me, I want you to help her. So when I went to see her, I found that she has done 2 back surgeries to fix her lumbar segment. Her neck is not stabilized. And before doing the back surgery, her doctor told her, "Oh, you are too much weight." So he pushed her to do bariatric surgery as well. And then she had like carpal tunnel in the two wrist, and then she was cut off just to clear the carpal tunnel. And I found a person when I went like nearly dead. She was on 900 milligram Lyrica,
Wow.
and she was putting morphine patch on her chest. She was out there using muscle relaxant for her pain. So the Lyrica, all what it did is put her in depression. She wasn't focusing. She is a professor teacher, by the way. So she wasn't able to go perform lectures.
Mm.
Her daughter cannot find her to talk to her. Her husband felt that she is not there anymore. So
Mhm.
when I saw her the first time, I don't know if she was hearing what I'm saying. She was kind of delirious. And I heard all this. And what can I do with this lady? Like, she's like very chronic now. For
Yeah.
years, she has been doing this. And then I told her, I took the challenge. I told her, listen, I don't know how can I help you with this mess. I will only do you one Bowen session, one. If you felt better, I will continue working with you. If you did not feel better, sorry, I'm not the practitioner for you. Whatever surgeon messed up your body, I don't know how to fix that. So I did only one Bowen session on her, one.
Mhm.
She felt at least 25% better.
Wow.
So I thought, okay, I'm continuing, but we need to lower down this Lyrica dose a little bit by little bit. Within 6 months, we got rid of 90% of the Lyrica. I took her off the morphine patch gradually. And then I told her, don't use muscle relaxant. And then I started to teach her hydrotherapy, the
Mm.
cold and hot technique. And I gave her exercise to do for the whole body to can do in the bed. I don't want her to stand on her feet and do, because she won't be able to. Especially the blood supply to her neck was so bad that when she does any neck movement, she will feel dizzy up
Right.
to this level. Like now, it's like more than a year now. You look to this lady, you wouldn't imagine how
Mm.
far she came. Her
Mm.
husband told me, thank you very much. You are a blessing. You brought my wife back to me.
Mm.
And her daughter would say the same thing. And then she started to refer me to other clients.
Mm.
But I don't have a clinic in Egypt. I was studying and I'm still doing training. So
Right.
I don't want to have a clinic. So I will be doing home visits. I don't want to be known by home visits in Cairo because I only want to go to places that I know.
Right. Mhm.
So yeah, so I'm grateful to Bowen Therapy and to you, Manon, to teach me this powerful technique because otherwise I wouldn't be able to help her. Yes, I gave her nutrition and hydrotherapy, but Bowen was the base of my treatment with her.
Mhm.
And this go back to what I started. If physicians don't have this in their heart, I don't think they are practicing the profession as they pledge to do. No harm and all the 10 commandments.
Mhm. Yeah, no, no, I agree. Why do you think? Because I mean, you have uh, knowledge in allopathic medicine, in homeopathic medicine, in natural medicine. So all these different things. Why do you think that Bowen is so effective?
What would your life be like if you were pain free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger I, live online for your body mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
Because and maybe I should interrupt people who don't know about this. You can always go to bowencollege.com. There's videos to show this, but essentially it's a very gentle soft tissue manipulation, or we don't even say manipulation because it's really just a little movement that wakes up the natural immune system, the innate healing system. I mean, that's the short version of it. And yes, there are shocking results that take place, but I've never really asked you why you think. What's the, combination of things, or what is it that why you think it's so impactful?
My experience with Bowen therapy started when I was training with one of your teachers.
Mhm.
During my training, I had frozen shoulder, and nobody ever did a full protocol on me. And just we're practicing the shoulder upper body thing, and no formal protocol whatsoever. By the end of the weekend, I was able to move my shoulder at least 90% better.
Mhm.
This is number one. Number two, Bowen therapy is very powerful in the way is I'm giving the body the same sequence every time,
Mhm.
and it's up to the body to heal in the way it wants. I'm not
Mhm.
pushing the body to do certain things. I'm just giving it a message.
Mhm.
I believe in the innate ability of the body to heal.
Yeah.
Like chiropractor, physiotherapists, like they will ask patient what problems you have, neck problem. Okay, they start to do neck manipulation. People are better at the end of session. 2 days later, they feel the same thing coming back on them. With Bowen therapy, I felt I am doing exact the same thing with every single patient, but the results are different.
Yeah.
Some people decide to heal their back first. Some people decide to heal their neck first, to heal their head first, whatever. So I will go with what the body wants. I
Mhm.
learned from you too how to read the body language, how
Mhm.
to feel the body needs with my hand.
Yeah.
Like I was able to feel the body needs with my hand. You taught me how to fish, and you did not put a fish on my plate. So now I am emphasizing, I am doing my own moves now.
Of
I'm
course.
not I'm
Yeah.
not sticking with what I learned as basics. I
Mhm.
feel like, oh, his area here needs some more work. So I will come up with, I don't know what I am doing. Like it happens naturally and it flows like that.
Yeah.
My hand knows what to do. And then I say, and I combine sometimes Bowen therapy with acupressure,
Mhm. Mhm.
thing I learned from naturopathic college. I might combine it with massage, with essential oils.
Mhm.
Like my session will be base Bowen therapy, and I put a little bit more additions from other stuff. I don't want to remove. I don't want to leave remnant to next time.
Right. Right.
Now I only leave the session with people feeling really well, no pain wherever. I will do whatever I can to make people in my session, in my presence, pain free.
Mhm. Mhm.
I don't do things as I was taught.
Yeah, yeah, it's okay. But let me just interrupt you here. If you look on the website, right, the Bowen College website, the mission is to allow the student to really connect to their intuition in healing. It isn't to be dogmatic followers of a methodology that's just the beginnings of this process, right? That's the tool I use, like you say, to teach how to fish. But it's the intuition is the most important part. Is to you have to be somewhat loyal to the technique for a while to be the student of it, to learn how far it can go, what it can do. But at one point, that intuitive healer within comes out and tells you, you got to do this now. You got to, nope, this is enough. Or let's stop right here, or whatever. And I think that's the pleasure of the practice. And it's really it's a dance where you learn to be just in tune with the healing process, right? It's yeah.
Exactly. And that's what I'm really grateful to learn because without knowing what Bowen can do, I wouldn't even add anything to it. And that's really made me special
Mhm. For sure.
because I have a genuine feeling and genuine willingness. I want this person to feel better. I
Mhm.
love her. I'm sending her love. I'm sending her positive energy, positive vibes. And I want her to be better. I want her to resume her normal life. I want her to live as much as possible, the better quality possible.
Mhm.
So if I don't have this in my heart, it won't reflect on my client.
Yeah.
I'm not saying I'm perfect, but I am passionate to medicine. I love what I am doing.
Mm.
And loving medicine as a mission, as a hobby even, made
Mhm.
me practice it that way.
Yeah. 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 Anyways, I mean, I'm so resonant with you. You speak my heart. Um, a question on the participation of the patient. How important is to you, the willingness of the patient to do what needs to be done, even if it's lay on the table and receive? But can you speak to that a little bit?
Okay, I do believe that working with patient is a 50-50 thing. 50% my part, 50% the patient part. And I always ask the client I work with, are you willing to change? Do
Mm.
you want to heal? Do you want from your inside to get better? If I get a no to any of these three questions, I will not work with them
Mm.
because I would feel that all my work will go to waste. If they don't have the willingness to heal, regardless what I will do, they will not heal. They might get better, but they
Mhm.
will not reach their full potential. If they
So,
will not follow what I am giving them as instruction to do from session to session, I know that the session will not as perfect as I want it to be. So
mhm,
definitely holistic practice. It's a mutual relationship between the client and the practitioner. It's not like conventional medicine. I'm giving you these pills, go home, do whatever you want.
mhm,
Like I'm giving you the sugar hypoglycemic medication, and I'm telling you to eat food, less carbs, but if you don't want to, that's fine. Take the meds. I
mhm.
don't do that. And I
Right.
explain to them that really this kind of uh, schooling, mental thing is hurting their body.
Yeah. Yeah.
Medication masks the symptoms.
Right.
Like as if you have an abscess like this and you put a bandage on it, or you have a fire and you put a cover on it. When everybody sees no fire is there, but the fire is still there.
Mhm.
Nobody's even trying to shut it down. So that's why I really believe in the 50-50 relationship.
Mhm. Now, so here's the issue I have with that. I don't disagree, to like, as in, I think the person who is conscious needs to want to go through the steps of healing, and they definitely need to remove that program of quick fix, big band-aid, whatever, because I think that destroys, humanity. But I have seen children that don't have an opinion, but they want to get better or not. They're dragged in, can you do something to fix them? Or when I was in Nova Scotia, I had a farm. And animals don't ask. I don't get their, I mean, I get their permission in the sense of, make sure they don't step on me or do something where I'm at risk. But I will do the work, you know, and they improve without, I would say, that whole conscious participation. They just receive it and get better. So I'm
I'm not
trying to
talking
understand.
about these two people, by the way. I'm not talking about animals or children. I'm
No, I
talking
know
about
you're talking.
adults.
Yeah, no, no, I get that. But so it is really an adult phenomenon. It's like when you have consciousness to say yes or no, that's when it
The
matters.
problem.
When the
Yes.
problem comes. Yeah.
Yeah.
Yeah. Okay,
Because
no, that makes sense. Mm.
I did treat my son, my younger son, Andre, was my guinea pig during my education as Bowen College. I will
Mm.
go home and tell him, Andre, I want to practice some move on you. "Oh, ma, come." And then I would press on him and he would fall asleep. I fall asleep under my hand. I have the book beside his body and I would follow the steps on in the book. And then he sleeps, I cover him and go, you know? And also, we had a dog that he was like puppy like this, and then he started to jump and hurt himself. And
Mm.
I'll take him and I put arnica in the water and start to do some Bowen move on him, and he's all better. I don't take permission from those.
Yeah.
But some adults are really stubborn and they don't want to heal from their inside. They feel like, okay, this is not for me. Then okay, if it's not for you, it's not for you. Why will I push you to do it? You know?
Yeah. Yeah.
So
Yeah,
yeah,
and it's
definitely children are the most recipient of
Mhm,
all
mhm, mhm.
because they don't have rejection. They are open for everything. Animals too.
Yeah.
And I dealt with both.
Yes, I'm sure you have. I don't know. And I would say the other group that actually I've seen success in is true skeptics. In other words, adults that are they're skeptical, like show me that it works, but they don't have the same resistance as the sort of unconscious patterning. Because there are people who don't want to get better for lots of reasons. A lot of them are unconscious, right? And I think that's a different group of people, like those who I've had people who like show me, and as long as they're funny and they have some humor and and it works with my personality, I'm like, okay, let's see what happens with you, and then they might come out and say, oh my gosh, I had no idea, that type of thing, that can be fun too. But I do think it does take the desire to go forward and to commit to something unknown, and I think as we're heading now with so many possibilities now that so many patents have been in health have been liberated to the world, and a lot of the things that existed in our past are being freed, for people to use. I think we're going to see an explosion of health and possibilities. And anyway, I'm feeling very, very optimistic. But our time is near, and can you, I mean, share the last few words, and then uh, can people reach you these days, or are you still kind of nowhere specific? Like, how can people connect with you? Or not
Can
yet?
we, can people do us? Sorry.
Connect with you.
Oh, connect with me. Okay.
Yeah.
They connect with me if they want through WhatsApp, through emails, on my
Okay.
Facebook page. Yeah,
Okay. Okay,
yeah,
great. But you'll be going back to Egypt for a little bit, right?
yes. For
Yes,
another year, yeah.
for a year. Okay, great. Okay, well, I'll leave you with the last few words to close our time together.
Yes, I will say that I am very optimistic that every one of us can do its part to change at least the milieu around us. I
Mhm.
will change my environment, someone else change his environment, and so on. And together we can work in this unity. And I believe all of us, we are led by the same move that we want people to live better and to feel better and definitely pain free because nobody should ever live with their pain. The word that medical doctor will say to their client, no, you have a pain, that deal with it, live with it. I hate when I hear this word. Nobody should live with pain at all. Pain is just something from the body to tell us there is something wrong. We need to fix this. And yeah, pain free is my goal.
Well, thank you so much for spending this time and sharing of your knowledge and your person.
Thank you, Manon, for having me. It was my pleasure.
Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.